Communication is the exchange of thoughts, messages, or information, and is expressed through speech, signals, writing, or behavior. Communication in healthcare is the process by which information is exchanged between individuals, departments, or organizations. If you consider it in terms of making connections, communication creates links between people and ideas. As a home healthcare provider, you play an important role in creating and maintaining these links. Learning to communicate effectively with physicians and other staff ensures the best possible client care and safety. This course has been designed with this objective in mind. I Pass the Baton is an acronym for a good method of structuring handoffs. It stands for I, Introduction. The caregiver introduces his or her job role. The client is included in the introduction. P, Patient. The caregiver provides the client's name, identifiers, age, sex, and location. A, Assessment. The caregiver presents the client's chief complaint, vital signs, symptoms, and diagnosis. S, Situation. The caregiver states the current status and circumstances of the client, any level of uncertainty, and any recent changes in response to treatment. S, Safety Concerns. The caregiver provides any critical lab values or reports, allergies, and alerts, such as falls. B, Background. The caregiver shares any comorbidities, previous episodes, and current medications. A, Actions. Actions that were taken or are required are reviewed. The caregiver also provides a brief rationale for those actions. T, Timing. The caregiver describes any level of urgency and explicit timing and prioritization of actions. O, Ownership. The caregiver describes who is responsible for what actions that will need to be taken next, including the nurse, doctor, therapist, and family members. N, Next. What will happen next? The caregiver shares details on the care plan, contingency plans, if applicable, and any anticipated changes to the plan. The caregiver also asks if there are any questions. To further illustrate the I Pass the Baton strategy, let's look at an example. Mrs. Brenda Jackson is being discharged from home care to the community. Cheryl Miller with Community Home Health has been her caregiver and is handing off care to her husband Joe. Using the I Pass the Baton strategy, she transitions care using effective communication. I, Introduction.
Mr. and Mrs. Jackson, my name is Cheryl Miller. As you know, I am the registered nurse who has been taking care of you for the past few weeks. As we discussed at our last visit, I will be discharging you from our services today and will review your discharge instructions with you and your husband Joe.
P, Patient.
Mrs. Jackson, you were quite a sick lady when you were admitted to Community Home Health from Brighton Hospital with pneumonia.
A, Assessment.
Your pneumonia was complicated with dehydration. You required oxygen, antibiotics, and IV hydration.
S, Situation.
You tolerated treatments very well. You no longer need oxygen, have completed your antibiotic medicines, and your lungs are clear.
S, Safety Concerns.
Occasionally you have felt dizzy when you quickly stood up to go to the bathroom. Dr. Woods is aware of this and feels this is related to you being weakened from your pneumonia and getting up too rapidly. That means that you have been in bed for a while and your body is a little slow in making quick adjustments when you change positions. If you get up too fast, you could fall.
B, Background.
You have a history of high blood pressure, but during your home health care stay, we noticed that your blood pressure had been low for you. Our readings have been 100/60 most of the time.
A, Actions.
This has led Dr. Woods to hold your high blood pressure medicine while you have been here. He also suggested that you sit along the bed with your legs dangling for at least 3 minutes before you stand up. Dr. Woods wants you to stop taking your blood pressure medicine until after you have a chance to see him in 3 weeks.
T, Timing.
Between now and your follow-up visit with Dr. Woods, which we have scheduled for Monday, November 14th at 10 a.m., your job is to continue to drink lots of fluids. You should try to take in at least 3 big glasses of water, juice, or other drinks without caffeine every day. Every day you should also take a short walk. Be sure to follow Dr. Wood's directions and take your time getting up from bed. You should not take your blood pressure medicines until Dr. Woods tells you to restart them.
O. Ownership.
Your husband will be taking care of you. If you have any problems during your recovery, it is very important for you to call Dr. Woods. Mrs. Jackson, I am discharging you today to the care of your husband. Do you understand?
Yes, we understand that we will assume care after you leave today, and we'll follow all your instructions.
N. Next.
It is normal for you to feel tired for up to 1 month. In a few days, as you begin to move around more, you should start to notice less dizziness when you stand up. If you get short of breath, have fevers, or can't drink enough fluids, you should call Dr. Woods right away. The discharge paperwork has these instructions, your follow-up appointment information, and Dr. Woods' emergency number written on it. Let's make sure that all these instructions make sense. Do you have any questions?
Using I Pass the Baton, team members that possess good communication skills are able to share accurate and complete information in a clear and concise manner, provide status updates, and verify information received. They are the best link in creating effective connections between clients and a safer care environment. And that is a link that is well worth connecting.